Hi, I'm Kirsten Delgado. You're watching WCI-TV, brought to you by Tower MSA Partners. I'm here with Dr. Chris Donaldson of Orthopaedic Medical Group of Tampa. Thank you so much for joining us, Doc.
Thanks for having me.
Congratulations on your award. You're accepting it here in just about an hour or so for Injured Worker Inspiration Award.
Yes.
Talk to me about this case and the level of success you're able to reach.
Yeah, I think the case for me is one for a clavicle fracture, so a collarbone fracture that we fixed. I think the important nuances around this case were really the way that the team together, from our staff, the nurse case managers, adjusters, all really worked together to get the best care for the patient. And then leveraging that forward in earlier return to work and better success on that side functionally. So all that's really important. And so we're just really excited that we got the opportunity to display that for this patient and for the team.
What do you attribute this level of success to?
Yeah, I think for us in our own practice, it's prioritizing the workers' compensation patient, right? The functional demands that we have to understand that those patients require, the performance demands. I have some experience as a trauma doctor from shock trauma and at Ohio State as an athlete doctor, so a sports medicine physician. But combining those two together and then delivering them back to the patients really who are industrial athletes, because those performance demands really transcend athletics and trauma in and of itself.
Right.
And so I think that's important.
So really having the background knowledge, that understanding of what really is at stake here for each individual. Talk to me about what you think the takeaways are for others in matching your level of success with this case.
Yeah, I think the takeaways would be, one, attention to detail is important, right? So there are some factors that can confound a surgery, identifying those early, being able to engage the patient and the carrier and work on a cooperative effort to get around those factors. And then the most important factor really is communication, right? Communication is that three-legged stool of the carrier, the patient, and the provider, and being able to play that tug of war together so that the patient really does get the best results.
Workers' compensation can come with so many complexities for so many. Talk to me about your level and your organization's level of really playing the role of being there and being through that process and being someone that's holding their hand and saying, hey, we're going to get through this and it's going to be okay. That role you play. Yeah,
I think the biggest part of that role is listening, right? A lot of people want to say it's doing, it's understanding, and all that's important. But I think it starts with listening. It starts with our staff listening, because you're going to get most of the answers just by hearing those patients, hearing the carrier, understanding the pressures that each of those are facing, and then helping to mediate that, prioritizing, again, that patient's care is important, but listening is where it starts.
Dr. Donaldson, thank you so much for your time, and congratulations again.
Thank you so much. I appreciate you.
Dr. Chris Donaldson of Orthopaedic Medical Group of Tampa. Thank you for watching. I'm Kirsten Delgado. This is WCI-TV, brought to you by Tower MSA Partners.